All right, I just wanted to start with kind of who I am. I'm going to try to talk really slow. I have a tendency when I'm nervous to speak very quickly. So if it seems like I'm going crazy, Lewis is going to give me the slow down. Fine. I've worked here for 14 years and pretty much exclusively, for the most part, with stroke for the last, I guess I would say, 9 years. So I get the pleasure of working with Dr. Jarnot. And I also get the pleasure of working with Inspire. I haven't given a talk in 5 years, I think, but I used to regularly present at Inspire. So I know a lot of you, and it's always wonderful to see everybody. And you guys all look exactly the same, just like me. I'm going to talk about some common emotional behavioral concerns after stroke. I have to explain, though, I kind of feel like I necessarily shouldn't be the one giving this because I haven't had a stroke. I'm not depressed. I have never experienced depression, and so I'm going to do the best I can, and you can feel free to fill me in on anything I missed or ask questions after. Okay. The caregiver burnout portion, some may know my mother has Alzheimer's, so in that regard, I have a little bit more experience because I'm watching my dad go through it and starting to have to support him as well. So we'll do the best we can, and we'll go from there. We'll just talk specifically about depression and how it relates to stroke, because I know a lot of people suffer from depression for other reasons, okay? So depression can affect about 1/3 of all stroke patients. Depression can happen because of the stroke itself. The damage to the stroke tissue disrupts those chemicals in the brain that we feel are responsible for contributing to depression, the neurotransmitters and things like that. And it can diminish, unfortunately, depression itself can diminish your recovery and your ability to heal. Sometimes the depression, or we hope the depression, improves as your physical symptoms improve, and as you start to deal with that, initial anxiety and fear and grief. You can experience that depression, and hopefully, again, as you make gains, as you recover, that improves as well. If you don't manage that, like if you can't accept the fact that you have this, depression, that can also affect your ability to recover. And unfortunately, from a couple of journal articles I read, untreated depression actually can contribute to your increased risk of stroke in the future. So depression also, not necessarily just the stroke or the situation, other things from the stroke, such as the pain, your inability to sleep, things like that may also increase depression. It seems like it's very intertangled with fatigue, which I'm going to talk about in a little bit too. So how do we know if we're depressed? When we have this scale that we use in clinics, sometimes it's called a PHQ-9, and it's very simplistic, but asks simple questions like, are you doing the things that you used to do routinely? Do you have interest in activities that you did previously? If you're finding that you're not, I mean, of course, some of it can be related to the initial stroke and some of those symptoms, but if you just don't have that, spirit anymore, you just don't feel the same way about things that you previously enjoyed, that can be a symptom of depression. Obviously, feeling down or depressed or hopeless. I know there's some guilt involved, like you feel like, what has happened? Is this my fault? Now what have I done to my family? That can be part of it too, and cause depression. If you notice you're more anxious or irritable, short-tempered, that can be related to depression. Then simply you're eating your feelings, or you don't feel like you can eat at all. Maybe you're avoiding your friends or people that you used to spend time with. Decreased interest, like we talked about. Maybe loss of confidence, self-esteem, Another sign, sleeping too much or not sleeping when you used to have a pretty good routine. Again, some of this can also be related to the stroke. So that's where it's really difficult to kind of say what is what here. When you have just problems with concentration or thinking clearly, brain fogginess, we hear about that a lot, and then of course fatigue or loss of energy, and that's something we'll talk about a little bit further down. How do we help with depression? Obviously, everyone knows that there's antidepressants medications. These can alter the chemicals in your brain that may have been affected and help lift your mood. And some people may want to wait and see how they recover and put this in play later. Sometimes when people come into the clinic and we're noticing it's significant, sometimes even our group will start an antidepressant and have people follow up if it's affecting your daily life. The biggest thing I found when I was looking into this is obviously professional support is very important. Talk therapy. I think acknowledging the event, accepting the change is gonna help, and talking through that with someone else that's not in your family may be helpful, or developing ways of coping and embracing this new normal that may have happened. So mindfulness and meditation, relaxation, listening to music, things like that bring you joy can help. I would say these kids today they use a lot of these devices, these apps, to deal with their stress, and I feel like we can take advantage of that too, even though we're not probably quite as cool as they are. And just my son uses it before an exam. He just does like a meditation app for like 15 minutes and kind of refocuses himself. I have something at the very end for just a minute, because I know you probably don't want to do it for longer than that. Just a quick meditation that we'll try together. Exercise. I'm going to probably say it about 10 times during this presentation, and Dr. Jarnett talked about the importance of this physically, but I'm going to emotionally, I don't know, I deal with stress by exercising. I don't do it for necessarily the health benefit of it, even because I don't want to, if I miss it, I miss it because of the emotional component. It takes away my day. And I think people don't give that portion of it enough credence. Like they hear, you got to work out. It doesn't need to be a HIIT interval workout. It's 5 minutes a few times a day, or 5 minutes as many times as you can, or 2 minutes. It's stretching, it's yoga, it's laughing, it's things that exercise your brain, exercise your body, and then the endorphins are released, and that gives you some ability to hopefully lift your mood and can help with depression. Okay. I just pointed out cognitive behavioral therapy. I found this interesting. This is something that's used currently for stroke quite often, I read, and it's specific to the event of stroke, and not looking at the past so much, but looking at what happened and then dealing with how to help with those symptoms now. I think a lot of people, when they hear about therapy, they're worried like you're going to dig back into like 20 years from now. No, right now, how are you feeling? What can we do to help you feel better? Okay, and I know there's a lot of cognitive behavioral therapy groups out there. Some are in Minnesota specific for that, and then I think a lot of the therapists that work in our behavioral health system here and some of our surrounding communities also have this CBT, it's called, I guess, for short. And then, of course, today's support groups. I mean, we know how important Inspire is. We know how important these caregiver groups are. I don't think, again, that people realize. We have in our clinic, we introduce it at the beginning when you come in to see us. I know a lot of people were introduced in the hospital by wonderful volunteers. And we just keep asking people, because sometimes people aren't ready. Maybe it takes them, a year, or even sometimes it's even longer than that. And but it's needed. It really is. A community helps. And then we always want to invest in relationships that lift us. And saying no. That's if you don't have the time or the capacity to do something, it's okay to say no. But try to surround yourself with the people that lift your spirits, right? Moving on to the post-stroke fatigue. Again, this is very interconnected with depression. So post-stroke fatigue is described as the feeling of early exhaustion with weariness, lack of energy, and aversion to effort that develops during physical and or mental activity and is usually not fixed by rest. So it's kind of considered to be almost an invisible symptom of a stroke. And again, this is the combination of probably the brain injury itself and all of those psychosocial stressors related to adjustment of this new normal as well. And this actually affects 40 to 70% of survivors. This is actually, in the years that I've worked with Inspire, the one, I had 3 different talks on fatigue because that's what everyone wants to know how to combat. And it's really difficult because there's not a good medication for that or a quick fix for that. So in a healthy individual, fatigue is basically a wake-up call to say you need to take a break or rest, and it's usually related to you worked out too hard, you worked too late, you didn't sleep last night. But post-stroke fatigue can be chronic, and it can be chronic dysfunction, and it can impair your daily life. And then I also read sometimes you don't know which is the problem, the fatigue or the depression, until you work at fixing it. So basically, you may be depressed thinking it's fatigue. You may be fatigued thinking it's depression. It's just so interconnected. So trying some of the tips for one thing, and if it's not working, or using it in combination, basically. So you're not just tired, okay? It arrives without warning. You're just exhausted. Again, it doesn't improve necessarily with rest. It can occur for days and weeks and months and years after your stroke. It affects everyone differently. And a lot of it, I'm sure, is depending on the area of the brain that's affected, how much of physical symptoms you have, how many physical symptoms you have, how you've dealt with this new normal. It can slow down recovery as well, just like depression. And of course, it's hard to stay motivated to do things. So just types of fatigue. We have physical fatigue, which can be caused by your motor deficits, muscle spasms or weakness that you may have. Cognitive types of fatigue would be, I did terrible on this slide, by the way, I noticed. Memory loss, trouble focusing, mental exhaustion, and then emotional types of fatigue. That causes loss of motivation. And then if you do have some underlying mood disorder already, this can just pile on top of it. So talking about managing fatigue. And again, in these other talks that I've given, I've talked about some things we can do, and I told Louis before, I did this at home, and it was like 40, 45 minutes, and then I did it again when I was starting to get nervous about it, and I could do it in like 20. So we'll see how this goes. So managing fatigue, modifying your lifestyle to reduce your burden of fatigue and promote recovery. Basically trying to diary or track, what might be contributing. Are you finding any patterns in your fatigue that maybe you can get help with? Like, when is it happening? If it's every day after, at 10 o'clock after you have breakfast and get moving, it's okay to have a nap. And then maybe after that, you do your doctor's appointments, or you do your activity, you go to the place that you wanted to go. It's okay to do that. And then kind of knowing a little bit more about where are you going, where are you parking, how long does it take to get in the building. All of these are really simple things, but sometimes I notice when patients are coming from the blue lot and they walk all the way through the building, like we're talking about, I mean, they're exhausted before they get up to our clinic. So it's just little things that you can do that might help. And then pacing oneself, again, just give yourself a break, especially in that acute time frame. People want to get back out and do everything that they did before. It's okay. If you broke your arm, you're not going to go out and be able to lift a suitcase. So it's like you have to give yourself time for your brain to heal as well. We want to get up and moving, but just, be realistic as well. Ensuring adequate time to rest and exercise, and sleeping. Again, sleep can be affected, and you can look at that too. Do you nap? Do you go to bed and get up at the same time? I mean, trying to structure these things might be helpful to manage the fatigue. Have you had a sleep study? I mean, do you have sleep apnea? Could that be contributing to why you're not sleeping well? Do you have spasticity or pain that you can't, move very well? Are there any things that we can give you to help with that? Adjustment position, things like that. And then medications. Sometimes medications can affect how you feel. There are programs through health partners as well as other insurance companies. Sometimes we can have you see a pharmacist and move medications around that are necessary and see if maybe taking your meds at bedtime helps with your daytime fatigue. Again, none of this is a guarantee. It's just trying to work with what we have to do the best we can. And then it's maintaining good hygiene. I just put this on here because I don't know about other people, but I get up, I take a shower, and start your day. It's something about having good hygiene. It just makes you feel ready for the day instead of sitting, in at home in sweatpants, which, obviously some days it's a sweatpant day, but, just maybe kind of keeping that in mind. It's you need the motivation to get going. Maybe, try to get in the shower or, do something that gets you gets you going. I thought this was really a couple cool quotes. It said, "Life is not about how fast you run or how high you climb, but how well you bounce." And some have suggested that happiness isn't the opposite of depression. Resilience is. And it's the ability, as James Brown said, to get it on up again and again. And in fact, to learn how to keep bouncing when life tends to keep trouncing. And I think you guys are a very, very good example of that. And then talk about it a little bit, and I try to be a really optimistic person. Sometimes it doesn't work, but choose to be optimistic. It feels better, and choosing your attitude for the day. Again, a little bit of a topic that I don't know too much about, so but I kind of can understand it in a little way from other diagnoses. But I expect that after stroke, there can be some role confusion. So maybe someone was the one that went out and did the garbages, or you had your roles, and things can change after a stroke. Maybe you're not physically capable of doing that. Maybe you're not mentally or emotionally capable of doing that, and that can affect relationships, intimate relationships, as well as friendships. And then also now there may be a lack of privacy. You used to be able to go to the bathroom by yourself, but now someone needs to help you, and that's going to change your relationship as well. And it can make you angry, I expect. It can make you feel guilty. And I'm sure the caregiver feels the same way, just differently. You might have conflicting demands that take your time. Some people still have to go to work and want to take care of their spouse or their friend, and that can be difficult. Those adjustments are very difficult. And then there's always a feeling, I expect, of not being equal partners in the relationship anymore. And you have to find, where everyone stands. And then, of course, financial concerns, which is unfortunately what makes the world go round. We have to deal with those things too. If you need more assistance, how are you going to pay for that? And if you're not working, or if that other person can't work because they have to take care of you, how are you going to do that? And we have a lot of resources. Unfortunately, there's a lot of resources out there. Let me just put it out there, because I'm doing a lot of research on trying to gather numbers for people in the memory loss community. It's just trying to find them. And I noticed you can find a lot, obviously, through like Alzheimer's for that. But there's also every community, every city tends to have a lot more options than you might expect for housing and help with housekeeping and transportation and support groups and things I never knew until I started looking. So if anyone's ever asking, besides Inspire, of course, because we're the best, but you can always, say like, hey, look at your community website, because you'd be surprised. You don't it's lots of it's sliding fee based too, so you don't necessarily have to pay whatever it is an hour now to hire someone to help with yard work. Just some tips for caregivers: letting the person know that you're willing to listen and let them talk, or just spend time with them. Sometimes it's just being present for someone is better than trying to fill in all the gaps. Supporting independence whenever possible. So I know a lot of us caregivers want to just do everything, and I think sometimes structure and routine for that person is really helpful. So anything that person can do themselves, we want to let them do themselves. And you can be standby, I guess. And then maybe setting goals that you can reach together, especially after the beginning of this, or the beginning of this journey, I should say. Short goals, small goals. And then I'm sure that some caregivers want to kind of take over, and some people who had a stroke want to deny having this happen, and trying to find that in between, that hope for the future, working together as a team. And then watching for burnout of caregivers, which how to avoid caregiver burnout. The biggest thing, and we tell our patients this and our caregivers this, is you can't take care of someone else and support them unless you are also at your best. And it's okay for the caregiver or the family member or the friend to also grieve this loss. It's part of their loss too, right? Especially in these intimate relationships that we have with other people who we've been with for years. And the caregiver needs to take some time off too. So a complete time off. If you can find someone to help, a day, a weekend, to just check out and give yourself time to reboot. If you can't do that, then a break every day to do your own thing. Exercise, read, listen to music, 15, 20 minutes, doing something that you love to do. Recharge your personal batteries, okay? And then, again, deep breathing and meditation can help the caregiver kind of reset, think about themselves, maybe journaling, to remind yourself when you want to slap someone upside the head. What are you doing this for? Why are you grateful? What are you grateful for? Things like that. And then it's okay to seek support from friends and family and others who are sharing a similar experience, just like we're doing here. And I encourage my patients who tell me they have great family members. I'm like, it's not the same support because they haven't been through what you've been through. So find your people, and we'll just continue to do that in the clinic, and we can continue to do that in the hospital. And then I'll talk about some tips and tricks, but we talked about optimism and that kind of quote about choosing optimism. I read somewhere that being optimistic is the characteristic most highly related to life satisfaction. And giving yourself the hope or feeling that you are capable of creating positive outcomes actually helps us to move forward and be motivated to move forward. So I know it's easy to say, but it's part of that behavioral therapy, saying like the glass is half full, and not half empty. So tips and tricks, and this was just a personal thing. I personally like to feel very connected to who I am and how I feel, and then again, the people that I choose to include in my life. I don't know if something happened at 50. decided I was just going to start saying no to things I didn't want to do, people I didn't want to be around, people that brought me down. So find those people that lift you up and set aside time to specifically focus on your goals, both of you, the caregiver and the person that's had the stroke, your behavior, your general state of mind, and that's separate from prayer or meditation. You know, it's just something to think about. I mean, this is now part of your life, just like you would if you were going to work and you had to think about your work day, kind of thing. And again, you can't be any good to people unless you are first good to yourself. So you want to make sure you are in touch with how you're feeling too, caregivers especially. Okay. And then I just put in a couple common questions. What demographic is most likely to have post-stroke depression? And history of stroke, the people that have the history of stroke that have suffered a physical disability, the severity of the stroke itself, and then depending on the location of the lesion, affects that, and then male gender actually is more common, and some reason ischemic heart disease, and I just don't know if that's maybe a risk factor. I couldn't find exactly why, but those are some of the people more likely to suffer from post-stroke depression. I think the history of stroke is if you had a stroke in the past too. The best treatment of depression when it comes to just medications in general are usually that selective serotonin reuptake inhibitor, the SSRIs, and then that cognitive behavioral therapy that I mentioned, that type of talk therapy that's very specific to the event, and then how do we move forward. And then what area of the brain that suffers the event would most likely cause depression? And it looked like it's the frontal lobe mostly, because that houses your emotions and your cognition and memory and the other advanced functions of your brain. So, and that kind of makes sense. And then the other questions I get all the time, again, is about fatigue. Specifically, are there any medications for fatigue? And we do say, again, that those SSRIs can sometimes help because depression and fatigue are so interconnected. But if that's not helping, there are some other drugs. One's called modafinil, and it's a non-addictive type of stimulating drug. Stimulator doesn't sound great. And then exercise, of course. I always gave my kids a hard time. When they were being lazy, I would be like, energy begets energy. Energy gets you motivated. Just keep the ball rolling. That we learn that simple science, right? And then I know sometimes Dr. Jarnett recommends B complex vitamin for some fatigue, and then vitamin D is another big one, especially in Minnesota, because we get a lot of our vitamin D from our sunshine, and we don't have it that much. So I'm just saying, because in the winter when the sun's out, we're not probably hiking around. So just be cognizant of that. A lot of people, for some reason, they don't allow us to do the testing in clinic anymore. We used to test everyone, but maybe it can be done like at a wellness visit for primary care. Maybe it'll be covered. And then if you're low, there's not really a toxic level of vitamin D. So, 2,000 units, 5,000 units, that's sometimes what we would prescribe for someone with like MS or something like that. So you can't go wrong with adding a little vitamin D. Just don't go crazy, because it's not cumulative. Like if you don't want to do 20,000 or anything. So just keep that in mind. And then this is just this 1-minute meditation that I wanted to play, and we can just a little sample of what you might try. And obviously everyone's got their own rhythm, so you don't necessarily have to like this, but it's just a sample. Oh, shoot. Sorry. And do I need help going back? Thank you.
Yeah, of course.
It's going to let me?
I wonder if it's not. We can finish up and then do it. Like we'll
Oh yeah,
go
yeah.
back into it.
Well,
okay.
I just had some sources that I wanted to mention. If you're ever looking, AARP actually has quite a few resources, and then American Heart and Stroke always have good resources. I found some information on the Stroke Association for United Kingdom, which actually was really patient-friendly. I know, and sometimes we have a hard time finding some things. There's some really good experts there, and then National Library of Medicine has books on pretty much every single thing, and a lot of them are free. We have some of them over here too. So, yeah. That was last slide. Sorry, should have had you stand
Nope,
here.
it's all good.